flu, symptoms, treatment, and prevention. Influenza, or flu, is a respiratory illness caused by a virus. Flu is highly contagious and is normally spread by the coughs and sneezes of an infected person. You can also catch flu by touching an infected person, for instance, shaking hands. Adults are contagious 1 until 2 days before getting symptoms and up to 7 days after becoming ill. This means that you can spread the influenza virus before you even know you are infected. Over 200,000 people are hospitalized from flu complications each year, and about 36,000 people are estimated to die as a result of flu. It is estimated that 250,000 until 500,000 people die each year as a result of flu. In industrialized countries, the majority of deaths occur among people over the age of 65. A flu epidemic, where a large number of people in one country are infected, can last several weeks. Symptoms. Confusing flu with a bad cold is common. Flu and cold symptoms may both include a runny or blocked nose, sore throat, and cough. To help you tell them apart, below are some symptoms of flu that are different from a heavy cold. 1. High temperature. 2. Cold sweats and shivers. 3. Headache. 4. Aching joints and limbs. 5. Fatigue, feeling exhausted. There may also be gastrointestinal symptoms, such as nausea, vomiting, and diarrhea. These are much more common among children than adults. Normally, symptoms linger for about a week. However, the feeling of tiredness and gloom can continue for several weeks. Flu risks and complications. In the majority of cases, flu is not serious, it is just unpleasant. For some people, however, there can be severe complications. This is more likely in very young children, in the elderly, and for individuals with other long-standing illness that can undermine their immune system. The risk of experiencing severe flu complications is higher for certain people: 1. Adults over 65. 2. Babies or young children. 3. Pregnant women. 4. Individuals with heart or cardiovascular disease. 5. Those with chest problems, such as asthma or bronchitis. 6. Individuals with kidney disease. 7. People with diabetes. 8. People taking steroids. 9. Individuals undergoing treatment for cancer. 10. Those with long-standing diseases that reduce immune system function. Some of the complications caused by influenza may include bacterial pneumonia, dehydration, and worsening of chronic medical conditions, such as congestive heart failure, asthma, or diabetes. Children may develop sinus problems and ear infections. Seasonal patterns of influenza and upper airway infection were found to be linked to a higher incidence of narcolepsy by researchers from Stanford University School of Medicine. Narcolepsy is a neurological disease characterized by excessive sleepiness and sleep attacks at inappropriate moments, such as during work. People with flu tell their doctor? A doctor should only be informed if the individual is frail or elderly, if their temperature remains high after 4 until 5 days, if symptoms worsen, or if the individual feels seriously ill, becomes short of breath, and/or develops chest pain. If worried, a phone call to the doctor may be a better solution than making an appointment. Flu prevention. Health experts and government agencies throughout the world say that the single best way to protect oneself from catching flu is to get vaccinated every year. There are 2 types of vaccinations: the flu shot and the nasal spray flu vaccine. The flu shot is administered with a needle, usually in the arm. It is approved for anyone older than 6 months, including healthy people and those with chronic medical conditions. The nasal spray flu vaccine is a vaccine made with live, weakened flu viruses that do not cause illness. Flu virus types. 3 types of flu viruses exist: Influenza A, Influenza B, and Influenza C. Types A and B viruses cause seasonal epidemics which hit the United States and Europe virtually every winter. The Type C influenza virus causes mild respiratory illness and is not responsible for outbreaks. From www.medicalnewstoday.com. Thanks for watching. Please like, share and subscribe.